According to the CDC, nearly 20% of children and adolescents are affected by obesity. It's one of the most common pediatric chronic diseases. So this morning we're talking with pediatrician Dr. Cyrus with what parents can do. Good morning, Dr. Cyrus.
Good morning.
So boy, talking about the difference between a personal choice and a chronic disease. This is a big differentiation. Obesity being a personal choice has always been the common conception.
Exactly. You know, everybody thought, well, you just need to, quit eating so much and exercise, and that'll fix the problem. And we've really learned that that's really not happening. We see it as a chronic condition, much like you see type 1 diabetes or asthma, any of these chronic conditions, and we need to think about treating them that way. And so do the parents. I mean, so does everybody out there with obesity in their family.
You've mentioned this before, but what is it about our society and food and our relationship to food and the food that's available? I mean, what is it about that interplay with what we eat?
Well, obviously we like good food. I mean, and we see it, fast food restaurants. We see you making those choices of either eating healthy or eating, fast food. And many times because of our lifestyle, we're, going to soccer or going to, some band or whatever, and we just pick up a quick, fast food thing. So their idea is to make those choices. A lot of times making choices, that are really hard to make. Many times they're like slow down, stop, get it at home, take it with you kind of thing, versus stop at the fast food restaurant and go from there.
Right. So when you talk about, there's this term, the obesogenic environment. We live in an obesogenic environment. How does that play into what we're talking about?
Well, when you think about obesity and you think about what factors into obesity, obesity thinks about like what food you're eating, but it also thinks about how much you're eating of that food. I mean, there is so many times we'd have a plate at a restaurant that is probably 2 or 3 meals of food, which is, everybody goes, wow, this was a big portion. We don't need to eat all that at one setting because it just starts to turn into fat, and it just makes the obesity worse.
What are some of the reasons for obesity? I know it can be your environment, your school, your house, just to name one of them.
Well, when you think about schools, our kids are at school for, 6-8 hours at a time. And many times it's their choices there. Is there fast food at vending machines with, Hostess, and I don't mean to beef the sweet treat idea, but is that a problem? Is there juice instead of water? Is there whole milk instead of skim milk? Then the home, is there problems with food as far as food deserts, fresh fruits versus canned fruits, having high syrups and high fructose sugars in them. So it really does make a difference on what our choices are and where we're making those choices.
What can be done? What are some options here for if my child or grandchild is obese and I want to get them on a different track?
Well, realize one, because it's a chronic disease, that it's not going to be overnight. This will not change overnight. It's something that's on a long trajectory, and staying with it is extremely important. So idea of exercise, diet management, portion size, but there's also medications that we start using in the older children, and I say older children, 8 years and older. And then there's also the idea of bariatric surgery in the very, very obese, greater than like 100% obesity. So when you get into that high rate or high range of obesity, it's extremely important because it's so unhealthy on blood pressure, bones, cholesterol, just the overall body is just really overworking itself.
And that's when you're young, and then that can only get worse with bones and joints as you get older.
Yeah, even fat can infiltrate the liver, and then it starts, infiltrating the liver and affecting the liver enzymes, and obviously we can't live without a liver. So it can cause a real short life.
Exactly. So I wanted to circle back. We have a little bit of time left. I wanted to circle back on the medications and bariatric surgery because I think people watching at home who weren't aware that kids were eligible for bariatric surgery or were eligible for weight loss medication medication, maybe their ears perked up at those two.
Well, when you think about, sometimes they can use oral medicines, sometimes the injectable medicines for weight loss also are being looked at. Obviously, most of these medications are for 18 years and older, so we're trying to do research on these medications to make sure that they are safe and effective in our children. If we can suppress their appetite, where again they won't eat as much, they can exercise, this all can start to come back and they feel better. The reports we get was just like, oh wow, I can't believe I was this big. I feel so much better. I mean, I just want to keep the weight off.
It can be a life changer.
Yes.
Dr. Scott Cyrus, thank you so much for being with us today.
Thank you.